Welcome to UMCC Medical Consultant Connectors, where your health matters to us. Ever wondered what impetigo is or how common this skin condition might be? Allow me to shed some light. Impetigo is a highly contagious skin infection that often graces us with its presence in the form of red sores and blisters. It primarily targets children, but don't be fooled. It doesn't discriminate against age. It's more common than you'd think, with millions of cases reported globally each year. So impetigo is not as uncommon as you might think, but what causes it? Impetigo, like many skin conditions, has its roots in bacteria. Now you're probably wondering, what kind of bacteria? Well, the usual suspects are Staphylococcus aureus and Streptococcus pyogenes. These tiny invaders are everywhere, from the skin to the environment, just waiting for an opportunity to strike. And how do they strike? It's often through a simple cut or an insect bite. You see, our skin is like a fortress protecting us from a myriad of bacteria. But once there's a breach, like a cut or insect bite, these bacteria seize the opportunity to invade and establish a foothold. Once inside, they start to multiply, causing the skin to become red and inflamed. This is the beginning of impetigo, a highly contagious skin infection that can spread to other parts of the body and even to other people. Now that we know what causes impetigo, what are the signs and symptoms we should look out for? Identifying impetigo early can help in its management and prevent its spread. It's a skin condition that's often easy to recognize, especially in children. The telltale sign of impetigo is red sores that burst open after a few days, leaving behind a distinctive yellow crust. These sores usually appear around the mouth and nose, making them hard to miss. What's more, they can be quite itchy, prompting a desire to scratch. But here's where it gets interesting. Despite their angry appearance, these sores are usually not painful. Quite the opposite, they can feel almost benign, which can make it easy to overlook them. Yet it's crucial not to ignore these signs. The sooner you catch impetigo, the sooner you can start treating it and stop it from spreading to others. So, if you spot these symptoms, how would a doctor confirm if it's impetigo? Impetigo can often be diagnosed based on its appearance, but sometimes further tests might be necessary. This common skin infection typically presents itself as red sores or blisters that quickly burst and develop a honey-colored crust. Because of its distinct look, a visual examination is usually sufficient for diagnosis. However, in cases where the symptoms are atypical or the response to initial treatment is not as expected, doctors may take a swab of the infected skin. This sample is then sent to the lab to confirm the presence of bacteria causing impetigo, like Staphylococcus aureus or Streptococcus pyogenes. Identifying the specific bacteria can be essential in determining the most effective treatment. Once diagnosed, what can be done to treat this skin condition? Impetigo, while uncomfortable, is treatable and its spread can be prevented. At the heart of treating this skin infection is a two-pronged approach: medication and good hygiene. The most common treatment for impetigo involves the use of topical antibiotics. These are creams or ointments applied directly to the affected areas, usually twice a day for about a week. Mupirocin and fusidic acid are often the go-to choices, proven effective in clearing up the infection. In more severe cases, or when large areas of the skin are affected, oral antibiotics may be prescribed. These are usually taken twice a day for a week and can include drugs like flucloxacillin or erythromycin. It's important to complete the full course of antibiotics, even if the symptoms subside earlier, to ensure the bacteria is completely eradicated and prevent a relapse. But treating impetigo is not just about medication. Good hygiene practices play a crucial role in preventing the spread of the infection. Regular hand washing is a must, especially after touching the affected areas. It's also crucial not to touch or scratch the sores, as this can spread the bacteria to other parts of the body or to other people. Avoid sharing towels, clothes, or bed linens with someone who has impetigo. And if you have the infection, make sure to wash all your personal items in hot water to kill any lingering bacteria. As with any health issue, early detection and treatment are key. So if you notice the telltale signs of impetigo, red sores or blisters that quickly rupture and form a honey-colored crust, don't hesitate to seek medical help. With the right knowledge and precautions, impetigo can be managed effectively and its spread can be minimized. To sum up, impetigo is a common skin condition caused by bacteria. It's marked by red sores diagnosed through clinical observation and treated with antibiotics. Preventive measures include good hygiene practices. Knowing this information is the first step towards keeping ourselves and our loved ones safe from impetigo. UMCC, your ultimate medical consultant connector.